Hello, this is Dr. Galloway, and welcome to Bridge History and Systems Review. We're going to start with a module called Bridge PTA to PT Didactic and Clinical Transitions. And the reason for this module in the introduction is to give you a little bit of background on how this course and likewise many other courses in the Bridge curriculum were developed to help take you from where you are in preparation and skill as physical therapist assistants and make that transition to the doctorate of physical therapy. So in this introductory module, what we're going to focus on is comparing and contrasting both the didactic skills from PTA to PT, and for that we'll focus on the board exam content outline, the NPTE. And then we'll take a look at comparing clinical skill levels and expectations utilizing the manual for the assessment of clinical skills, so the PT Max or the PTA Max. The other common clinical tool that those of you in other states may be familiar with is called the CPI. But the thought and the concepts in the transition are similar. Okay, I have a little bit of a bridge background and history information for you, much of which you're probably already familiar with applying to our program, but it's just to give you a little bit of a background in case you weren't aware of all of this information. And so this is not part of the major objective, it just helps with context. Okay, and for your cohort, we have the new update in 2018, and with the changes in clinical education and us having more full-time clinical education hours and not the clinical application 1 and 2 part-time clinical education courses, the need for this history and systems review course was identified. And then I'm sure you're also very familiar with all of the criteria that you work so hard to accomplish in order to be admitted to the program. The bolded part here is just to indicate that in designing and implementing bridge courses, the faculty consider and utilize your work experience as a PTA to think about how we can optimize your experience with that, but also still provide appropriate information and appropriate depth and appropriate amount of detail, considering that you've all worked in various clinical settings up until this point. Okay, so to take a look at the board exam content outline first, and this as well as the clinical comparison is in a table format. Okay, and so as you go down, how to look at this table is to compare across. So we're going to compare to start with the physical therapy examination with the corresponding physical therapy data collection and so on down the table. Now, another helpful thing to note is that the test content outline follows a similar format to the patient-client management model in the guide to PT practice. So where we begin with examination, then we go to evaluation, which also includes differential diagnosis and prognosis, and then interventions. And so you'll note that similarity as we go through the guide to PT practice in the next module. So this course, History and Systems Review, is a significant component that differs in the physical therapy examination as compared to what you have been accountable for as a physical therapist assistant. Okay, so for example, in your competencies course, we're reviewing and going back over and making sure that you're competent in various types of data that we expect you're already familiar with as PTAs. Doing test and measures such as manual muscle testing and goniometry for range of motion, taking vital signs, etc. And those are things that you've been doing as a PTA. One of the differences, however, is that you're collecting data that often you may be directed to collect, or is already determined that that's important data to collect, because the PT evaluation is already done. Sure, there are definitely times where you need to give input into that and make suggestions, but now, as the evaluating physical therapist, you'll be beginning with just the consult and needing to take the initial history and perform an initial systems review to then determine, well, what test and measures are most appropriate for this patient or client. Okay, so this course really focuses on this component here. And then at the end of that process of doing the chart review, the interview, and taking the history and systems review, being able to make decisions then about the specific data that's to be collected in the remainder of the examination. Okay, and as we go down here as well, again, comparing across, PT section is called Foundations for Evaluation, Differential Diagnosis, and Prognosis. And in the PTA board exam, that section is called Diseases or Conditions that Impact Effective Treatment. So here again, we're definitely expecting that you come to this program as PTAs with being familiar with pathology and conditions, and being aware of what those clinical presentations look like for a variety of patients, being aware of how that can influence your work in progressing those patients towards their goals. Now, the added responsibility is that the interpretation is at a more complex level to guide decision making. Okay, and differential diagnosis, which will be thematic across many of your courses in this program, is an added component in order to determine, are there other things going on, and what systems and what components of this person's body systems are actually contributing to what we're seeing clinically. And are there other maybe non-musculoskeletal things that could be going on that we need to address as well? And then part of the process as well is then coming up with what the plan of care is going to be and determining the prognosis. So there's several bolded sections here that are addressed throughout many courses in this curriculum to help improve your ability to be a decision maker in that section. And note that coming up with the plan of care is actually in this section. The delivery of the interventions is actually a section that is comparable across the PT and the PTA. I will note that one difference here is that on follow-up visits as a physical therapist, if you're carrying out the plan of care and delivering interventions, and you notice, of course, that something isn't progressing as expected, or there's a new finding, and now you have the decision-making ability to determine, well, do we need to reevaluate? some components, and you're able to perform that role as a physical therapist, or be learning to as a student physical therapist, without having that step of once you're licensed, you won't have that step of going to then a supervising PT. While you're on your clinicals and in this program, of course, you'll still be conferring with your clinical instructor. Okay. Non-system domains also is pretty comparable with the research and evidence-based practice component, having a little bit higher expectation, particularly in terms of statistics, for the physical therapist, compared to what you were expected for the PTA exam, and that's addressed in the evidence-based practice course, but also threaded in presentations and review of literature and other courses as well. Okay, now taking a look at the clinical skill comparisons. Okay, similar format. We have a table, so you're going to compare left and right across the sections. And this, for our program, this is the tool that you will utilize in clinical education for your skill checkoffs, and you'll become a little bit more familiar with that tool as you get closer to those full-time clinical education experiences. So looking across again, we start with professional behaviors, and here we definitely have an expectation, and which is validated by feedback from our clinical instructors, that bridge students who have that PTA experience definitely come in with an understanding of the healthcare environment and what it means to be a professional in a healthcare setting, and ask great questions and come ready to learn, ready to communicate with a variety of different individuals, patients, family members, clinical instructors, other members of the healthcare team. And that's definitely a positive attribute going into your clinical experiences. There are some professional behaviors where the expectation in the physical therapist performance is a little bit different and of a higher complexity than what is expected in the PTA role. And these just have to do with new challenges, and I've mentioned these over here as it relates to use of time and resources, responsibility. And for traditional and bridge students alike, the problem solving and the critical thinking that goes along with those evaluative skills definitely takes time and reflection and preparation for sessions, reflection during and also after patient encounters to continue to improve your skill in those areas. And that's normal, and that's expected. Okay, again, the section I've bolded here, which is of course the focus of this particular course in the program, is really all new compared to what is in the PTA Max. There really aren't any comparable skills for history taking, for pharmacology, or for systems review. So you have coursework specific to pharmacology, and specific to imaging, and some other courses that will apply here as well. But what we're going to focus on in this course for the history and for the systems review is foundations and processes for really how to continue to develop those skills across the entire curriculum in this program. At this point, as physical therapist assistants, I definitely expect that you're familiar with the chart review process, the The difference now is the chart's going to look very different. There's not going to be, of course, a PT evaluation in there, and at times you could get a referral that has just the bare minimum information on there, and so gaining skill and confidence in how to proceed with either a little bit of information or a lot of information or conflicting information is part of what we'll practice in this course. For test and measures, there are some overlap and similarities. When comparing the PT and the PTA tools, one of the biggest differences is the behavior level that is expected. So as a PTA, it's more to identify, to administer, to monitor, and of course discuss with PT as appropriate. And so for these skill areas in the PT Max, you're going to see more of assess, evaluate, analyze, and determine. So more decision making. And of course, the examination and evaluation does not have a corresponding section in the PTA Max. So this is definitely a new skill area that you're going to develop across many courses in this program. Okay. For prognosis and plan of care, in your PTA role, of course, you understand what a plan of care is and are responsible for knowing if the patient is progressing within that prescribed plan of care. And now again, you'll have in your developing PT role more responsibility for actually formulating that. Discharge planning is another component that is considered in the history and systems review, that that's going to be part of it, but the discharge planning decision making actually happens in the prognosis and plan of care component of the PT Max. And so again, there are multiple courses where you'll practice that for different patient populations. Interventions, it's similar in comparison to the test and measures here, where we see similar skill topics, and we just see an elevation in the behavior level that is expected. So again, now we're going to evaluate, select, make recommendations. And these last two sections are a little bit different in structure and format between the two tools. So if you'll just note these sections here in the PT Max. And again, when you get to reviewing this tool later in the curriculum, you'll take a look at the objectives that go along with all of those individual skills. Okay, so I'll let you take these just a short, brief couple of self-check quiz questions. And then if you want to look at more detail, the board exam content outlines, and I believe you linked to these in your professional issues course as well, is here if you'd like to go and look at more detail of the test content outline. Your PT Max, you actually later in the curriculum, and Dr. Smith will be in touch with you about when you gain electronic access to that course. So in this course, I'm not testing you on any further detail about the PT Max than what I've presented in this module. Okay, so I look forward to having some time online and on campus with you to discuss these modules and the lab activities further. And so for now, happy studying. Thank you for listening.